So I think that we can start. I can already see that there are quite many people connected. So a warm welcome to everyone to our fifth webinar on environment and health tools. My name is Francesco ZAMBON, and I'm the coordinator of the Regions for Health Network, and I'm speaking from the Venice office. Now we are experiencing actually a very high tide also today, as you might have heard from the news worldwide, I would say, but we are safe, and we actually spoke about climate change and extreme weather events in the previous webinar of this series. Today we are going to speak about a very interesting topic about urban green spaces, and we have two excellent speakers for that. I would just like to say a few things at the beginning, and after I will give the floor to our speakers. If I can kindly ask everyone to mute your microphone, or maybe Philip can also mute everyone by default so that we don't have any background noise. And first of all, thanks to you for making the time available for this webinar. Thanks to our speakers, and thanks to also Philip Baumann from the Bonn office, where this virtual meeting is actually hosted today. This webinar series, for those of you who are not familiar with that, is organized under the Regions for Health Network in collaboration with the European Center for Environment and Health located in Bonn. And it actually came as an idea after a workshop that we had at the European Public Health Conference in Stockholm last year. I think it was exactly a year ago. And it was a presentation done by Matthias Braubach in Stockholm, where he briefly introduced some of the tools which are developed by WHO in the field of environment and health, practical tools. And the audience present in the workshop actually asked to have more information about this webinar, about these tools. And so the idea came to have 6 webinars, each one of them targeting one of the tools which are available by WHO. So today the floor is actually back to Matthias, where the original idea came from a year ago. Just for you to know, all the webinars are recorded, and also this one is going to be recorded. So in case people are not able to attend this webinar, they can see later on under the YouTube channel of RHN. And if I can ask you to channel any question that you might have at the end of the presentations through the chat, which is visible to everyone, and then we will direct the questions to the two speakers. I think that I don't want to take any other time, because we have two very interesting presentations. The topic of today is going to be urban green spaces, and there is a recent policy brief which was published by WHO, and that will be illustrated in depth. And also it will be clear what kind of pathways to health urban green spaces can have and have actually in the lives of every one of us. And we will also touch upon some issues about equity and how urban planning can also actually contribute to should contribute to increase equity in a city and among social groups and towards social cohesion. We have two speakers today. Both of them are working in the European Center for Environment and Health, which is the WHO Bonn office. We have Matthias Braubach and Pierpaolo Mudu, who are both technical officers and who are the most expert people, I would say, on these topics we have in WHO Europe. And so we are very happy and grateful for their time to join this webinar. Matthias, I think that you are set to start. Once again, thank you very much for your time, and I'm really looking forward to hearing your presentation. The floor is to you.
Thank you, Francesco, and thanks for everybody joining the webinar. We have planned to talk roughly a good half an hour, maybe until 20 minutes to 12, about the project work ongoing on urban green spaces. And at the end, there will also be some highlighting of ongoing work on blue spaces. And then there will be hopefully sufficient time for questions and answers and anything that has been raised as an interesting point for follow-up during the presentations. If I'm not well understood by audio, please let us quickly know. Otherwise, I'll be launching now into the presentation. And first,
very well.
Great. Okay, so then we go on with the presentation. First, I would like to give a very quick overview of the European Center for Environment and Health that is located in Bonn. We have 3 different programmatic areas focusing on living and working environments, on water and climate, and a program on environment and health impact assessment that is more cross-cutting and methodological. And within this, the main focus of today's presentation will be on the urban and built environments, but of course urban green spaces have direct linkages to quite a lot of the other technical work areas that we're covering: air quality, environmental noise, climate change, health impact assessment, and environmental health inequalities. So it's a cross-cutting task, and it has a lot of overlaps and interfaces with health and well-being. The work on green spaces in WHO has been started in 2010 with the outcome of a ministerial conference in Parma, and the declaration committed the member states by 2020 to provide each child with access to green spaces in which to play and undertake physical activity. And as a follow-up to the Parma Declaration, WHO intended to develop indicators that measure the performance of member states and looking at how much are we improving the access of children to green spaces. This has been the first political commitment, and it has been followed up later on by, I would say, even stronger political commitments like the Sustainable Development Agenda with the goal 11.7, also covering the access to green and public spaces, and then a year later, the new urban agenda adopted at Habitat 3 conference, which has an almost similar statement to prioritize accessible, green, and quality public spaces. So there's a lot of political commitment on this subject, and for the Parma Declaration, we have in WHO the task and the challenge to develop indicators on how to measure green space access. So looking into this measuring of accessibility of green spaces, we quickly saw that we first need to go with a review of evidence that should be the base for any development of such an indicator. So from 2013 to roughly 2015, a lot of time was invested in a review of evidence on the health benefits and the health risks of urban green space. And based on that evidence, an indicator on accessibility of green space has then been produced, and it's also suggested in one of the chapters of the Urban Green Space report. There are a wide range of pathways and mechanisms how green space can affect health and well-being. It would be way too time-consuming to go in detail into each of them. So here you have an overview of all the different pathways, looking at UV exposure, at flood mitigation, nature connection, urban heat island effect, air quality, physical activity. It's a wide range, and it's really amazing what green spaces can have as an impact. For our work, we have broken that down in a kind of flow chart to make it a little bit more structured. And you can see that on the right, the overall pictogram. It is too large to show it in a way that everybody can read it, so I've been breaking it down in different subjects. The main idea is that we have certain characteristics of urban green space, and these have an impact on impacts, the way how you use the green space, the way how they affect the settings, for example, the land price, and the environmental regulation services that are the ecological benefits of green spaces that are not exclusively human benefits. From there, we have different pathways that lead to health, And we have also the individual status, what is the healthy lifestyle of people, how much do they actually use green space, what is their mental state. We have, of course, the physical environment that is affected by the green space, and we have the social environment that also is a part of the way we use and experience green space, because we don't do it alone. And from there, then you get to different health outcomes on physical health, social well-being, and health inequality. And it is quite amazing, as I said before, how many health impacts can be affected by green space. So if nature were a pill, it would be for sure reimbursed by healthcare insurance, but actually it's a public good and it's to the benefit of all society. So from this review of evidence, we moved into an evidence on action review. That was done in 2015-16 and was finally leading to publication on urban green space interventions. The main idea of that work was to look into what works best to deliver effective and equal health and well-being benefits. How do we design and use green spaces in urban settings to maximize the benefits? And the work we have done here was on two working tracks. One was a review of published urban green space interventions. So it really had to be interventions where you had the before and after set up in the survey, and that provided academic evidence on what is out there and has been reviewed and evaluated from a research perspective. But then we also launched a case study review where within the European region from all 53 member states, we asked for urban green space case studies on what local authorities, local NGOs and other actors have done on the ground in their city to intervene on urban green space. And what did they do and how did it work and what did they learn from it? Overall, we selected 48 surveys for exploitation, for 15 interviews, a qualitative follow-up was done, and 4 of the city representatives were then actually invited for an expert meeting to bring in the local perspective. One of the main lessons learned from that work was that urban green space may be considered a physical or infrastructural setting, but it is very strongly associated with social dimensions and social well-being. And just to give you these two pictures as an example, there have been in Turkey and in Germany, and this is probably not the only examples, strong public protests when it comes to local authorities cutting down on urban green spaces and parks. It really is something that people need. It's something they are attached to, and they are very likely to raise their voice when these green spaces are reduced, limited, or actually completely abolished. So step 1 of that work was an evidence review, as I said before, and there are take-home messages on what type of intervention seems to be having an impact on health. We found promising evidence on health benefits related to interventions on urban parks, especially when they were combined with social promotion programs. That means you don't only put a park there and hope that people will come, but you also do some social events around it to promote the space. That worked very well. There was strong evidence for the greening of vacant lots and street trees, so it can also be small-scale greenery that has an effect, and green spaces used for stormwater management to reduce the risk of flooding also showed as a significant benefit. There's inconclusive evidence on park-based interventions when they don't come with social promotion programs, and there were some studies on greenways and trails for walking and cycling, some pointing to showing benefits and some not delivering benefits. So it's a little mixed there, and largely because of a lack of strong studies, there's limited or no evidence on quite another range of green spaces such as pocket parks, green walls, and so on. We also have very little information on the long-term impacts of green spaces, the economic benefits, and to what extent urban green spaces may also have adverse and unintended consequences, and what is the impact on equity. There's something, but not very strong material about it. So these were, in a nutshell, the results of the review. But more interesting for our work was actually the review of European case studies. We selected 48, and you can see that most of them were interventions on public parks or large public green settings. Then there's a few on green spaces in enclosed areas such as schoolyards that are to some extent publicly accessible, but it's not like a park. And then there's a few others on green space settings, and a large number on different types, which mostly is represented by a combination. So there was a public park that was next to a riverside, and it created a lot of green spaces for sports activities, so we could not allocate it in one of the standard categories. So these usually are multiple interventions that combine different settings and outcomes. Just to give you some examples, the case studies that were submitted, they were from different spatial dimensions. We have some that work on a regional scale, and they look at urban woodlands around the city. Many of them affected the whole city and were urban interventions, and quite many were also very local, only in one neighborhood, only maybe in one park, in one public area of the city. We had very cheap and very expensive interventions, so it does not depend on budget alone what can be done. We had urban parks and playgrounds and recreational settings combined. There were a lot of case studies that had a combination with blue spaces, because blue and green can't really be separated. Most of times blue spaces have some green environment setting around them, and they were often used together in many of the interventions. We also saw quite some brownfield interventions and area regeneration approaches, be it a refunctionalization of former industrial areas, a landfill, a stone quarry. There were a lot of functional changes where areas that were formerly not the best part of town were made accessible and lifted in quality through green space interventions. We saw quite a few interventions with a gardening and edible green spaces approach in schools, but also in public settings. And schools and institutionalized settings were not that often, but we had a few from a few schools, and also one or two nursing and health institutions using green spaces for therapeutical purposes. In many of the case studies, and I think that was one of the main lessons learned, we see that case studies do combine social and infrastructural action. That's what we call the dual approach. It's not only about making green spaces available, it's also about promoting them to make sure that everybody is using them and you have the best benefit for the investment. So these two things coming together was a very successful recipe. To show a little bit more information on the case studies, we asked for the focus and the objectives that the local authorities try to achieve by green space investments. And the most important objectives were the general creation of urban environmental quality to maximize benefits on a general scale and promoting active lifestyle. But also some of the interventions had a main focus on equity and environmental justice and to arrange equal and fair living conditions across the city. And a few of them also had the main objective to reduce health impacts. But usually the health impact is more a side effect of the other interventions. When we asked in more detail what are the expected outcomes, those studies that said we have mainly an environmental focus, they mainly wanted to improve the general attractiveness of the area, and there were quite a few case studies that combined biodiversity conservation and ecological approaches with urban purposes such as recreation and leisure. When focusing on active lifestyle promotion, mostly the case study said that they wanted to increase time spent outdoors for the citizen by creating a nice green space environment. And then, of course, there's promotion of walking and cycling and promotion of leisure and play as the main outcomes. Those case studies that focused on equity were largely looking into a spatial approach. So they would look into urban quality and disadvantaged areas. It was less a targeting of certain target groups. It was more a targeting of disadvantaged areas to make sure that they are having an adequate quality of life and are not completely separated from urban development. And the provision of equal access to green spaces was also one of the major purposes of these case studies. When it comes to the case studies focusing on health outcomes, it was not broken down into specific diseases That was usually rather rarely the case. Mostly, it was a general improvement of quality of life with the expectation that this would lead to health and well-being benefits. So moving on, one of the main challenges that we noticed is that there was very little information from the case studies on the impact of intervention. Only 38 case studies were able to provide some information on that, and the outcomes that are collected for evaluating the case studies are largely related to active lifestyle environmental data, because this is rather easy to monitor. But even when it comes to health status and equity and some of the environmental dimensions, when you look into this in more detail, it's very obvious that most of the information collected to evaluate the interventions is very vague, it's self-reported or observational. So we would have information such as 20 people joined the walking group and they all liked it. Whether they would have been walking somewhere else anyway and you don't have much of an additional benefit is not clear. So on that side, most of the case studies were rather weak. So the lessons learned internally for WHO was that when you want to know about impact of green spaces, it's much better to look into research than the practical case studies. But when you want to know how it is being done, then of course the practical case studies give you so much more information than the research papers. It was very important to see how local authorities work with green spaces to put the academic knowledge in context. And we also saw overlaps in the way that the dual approaches, combining infrastructure and social interventions, were not only requested by research and academic papers, but we also found that in practice. It is often done on the ground, but we saw a difference in the way that from a research side, equity is usually looked at as an outcome variation, like what people are more or less benefiting from an intervention, while in practice, it was not that much targeting people, it was targeting locations for the green space interventions. So that was different between practice and research. And as I mentioned before, the main challenge we find is that there's very little strong evaluation of practical action, and that could actually be a research opportunity for universities and academic institutions to join together with local authorities and have an evaluation of these interventions. Inside WHO, what we learned is that it's maybe more interesting to focus a little bit more on the how things are being done and not only on the what. Okay, went too quick. I'll jump that. Go back. Okay, so we just go back one slide. The main guidance that we have taken from these case studies and to some extent from the research papers is that you need to have a clear set of objectives. What green spaces should be built for what purpose and for what population group, what function should the green spaces have? Because often there is an idea that green spaces, put them in and it will serve different user groups, but then you might have a lot of conflicts because some people might want to have a relaxing walk in the quiet and enjoy the scenery, and at the same time you have kids playing soccer, and if this takes place in the same space, it might lead to social conflicts and tensions, and then for both of these groups the benefits are strongly reduced. So it's important to be clear on what green space, for what function, for what target group. Green spaces have a very important long-term implication because if you build a park, it takes a long time for it to grow to be in the state that you want it. Sometimes it might take you 5 years before, or even longer, before a green space is ready the way you want it. So it is sometimes difficult because after 1 or 2 years, you might not yet have the benefits that you have invested for, but it might still take some time to see these benefits evolving slowly, and sometimes in local politics, that time is not necessarily there. What is also important is the planning context. Successful case studies tended to look a lot how they can put green space planning into the master plan. And it did not only look at individual green space projects, it also looked into adding green spaces into any type of spatial planning. So if there was a highway planned, green space planning would be part of this. Is there a new residential quarter? Green space planning would be embedded. So it is also then this bigger picture that is important, because by thinking bigger beyond the green space intervention alone, it is a larger approach that considers green spaces as a social and a public health investment, also providing the setting for cultural events, for consumer groups, for different groups building within society, for sports clubs, giving them a setting to have their events and have cultural and social activities. So it goes way beyond green space planning. It has social and cultural implications, and that's the bigger picture that was also embedded in some of these case studies and seems to be quite important. There were, from some of the case studies, certain design tips on what works. For example, it is important, that's not much of a surprise, but it still is something that has been pointed out, to build the green space close to people. The moment you have it, a nice large green space, but it's 1.5 kilometers away, it's very unlikely to be frequented a lot from different people living 1 or 2 kilometers away. So close to people is paramount, as well as diversity of green spaces. So that relates on the one side to diversity of greenery. Don't only have grass, don't only have the same type of bushes, but have a diverse green space with different species, but also have diverse functions and diverse sections within the green space. One area to play soccer, one area to sit and relax. Simple design was called for. It was very difficult to define what that is, but often simple, easy measures were very successful, and it doesn't need to take a lot of money to have something working. One thing that was highlighted by the local authorities as a challenge and often ignored or at least underestimated is maintenance needs of green spaces. They do cost in the long run. You have a constant maintenance need and you have to budget for that, because the moment maintenance goes down, people start not using the green space anymore. So it is very important to keep it maintained. There are, as you probably know, a lot of urban green space trends across the world. There's a lot of large investments on a local as well as a regional scale, but sometimes something very easy like this sign in Copenhagen with a fortune wheel, just making people aware of there's so many green spaces around. You can scan them with your smartphone. It gives you information how to get there, what kind of functions. This doesn't cost much, but it promotes the green spaces. It doesn't create new green spaces, but it makes those that you have available easily accessible. So you don't take a huge investment to make green spaces more accessible. So what we then had was 2 reports on evidence on urban green spaces and health and on the urban green space interventions. And we combined these 2 reports to come up with an action brief that summarizes the lessons learned and the key messages for especially local stakeholders. The practical guidance that is provided in this brief is split up into 8 sections. So we look, of course, into the relevance of urban green space and the interventions and the benefits. But then we also look into what works on the planning of green spaces, how to design them, how to ensure community engagement and stakeholder collaboration, how to promote the use of urban green spaces, the dual approach, how you make sure people actually use them, how to monitor and evaluate urban green space interventions, and what are the variables that you want to consider. And especially important for us is how to prevent and manage potential challenges and conflicts, because urban green spaces also bring risks. They have the potential for social tension, as described before. How to manage that to make sure that you largely have benefits and you minimize the risks. The Green Space Action Brief is quite well received, and we have until now 5 translations that were done by sometimes national and sometimes regional, sometimes local actors or NGOs to provide this brief in their national language. So thanks to all of them who have invested on money and resources to make this and translate it into Finnish, into Portuguese, into German, into French, and into Italian. I would just like to give one example on the action brief content for the case of preventing and managing health challenges. Here we have a list of the potential challenges and conflicts, and based on the case study review, what has worked in our case studies to mitigate and solve these challenges and conflicts. So for example, the conflict between users and the competition for space, the degradation of urban green spaces. If too many people use a small green space, we have discussed what to do when community dissatisfaction with the urban green spaces becomes a challenge. Safety issues, which is very important. A lot of people not using green spaces because of safety perception. Gentrification and the rising prices around intervention areas, and the increase of health risks related to urban green spaces, because they do pose some risks and it has to be managed. And the final point is on the budget side. How do you deal with uncertain or reduced budgets for maintenance? This all has been pulled together in the Green Space Action Cycle that we propose for local action. And it's important that the review of effects of green spaces on the local environment is not only done for the users of green space, because from them you will tend to get very positive answers. I like the green space, I use it every week. It's very important also to look at those people not using the green space and identify why are they not using the green space, because that should be the target group, not that much the people that do use it. We need to target those that don't use it and find out why and how we can serve them by green spaces so that they start using it. There were 3 key messages overall that were derived from the action brief for local authorities, and I think the most important one is the number 3. Local authorities are responsible for protecting and maintaining existing urban green spaces, and the maintenance is extremely important because often you may not have funds to get new green spaces established. At least maintain and protect those that you have. And that was a strong key message that came up from the local case studies, that there are budgetary issues and protecting what you have is sometimes the most important thing that you can do. From here, I would like to move on to a Blue Health project that we are currently working on, kind of transferring a little bit from the green space work to Blue Health. In that project, we are establishing a decision support tool for local authorities to act on blue spaces and increase the benefits and reduce the risks. The tool will have 3 different tracks, one looking into how to protect human health, and 2 will look at benefits, one the human health benefits of blue spaces, and the other is the ecological benefits of blue spaces. So this will hopefully be available in 1 to 1.5 years from now. It's part of a larger Blue Health project funded by Horizon 2020. This is what we're currently working on. And a lot of green space information is going into the Blue Health project because, as I stated before, you can't really disentangle the blue and the green. In planning terms, they often come together. And I would like to end with this one before handing over to Pierre with some additional words on a real tool on green spaces. This is how over time we have used our resources and how we have globally contaminated and polluted our world, how energy use goes up, water use goes up, forest loss goes up. So we are losing a lot of nature and biodiversity. And this is showing here, biodiversity is on a downward trend very strongly. So any type of nature in any type of setting is an added value, and urban settings can deliver quite a lot in this area. And with this, thank you very much. And I would like to give the word to Pierpaolo, who will say a little bit on the Green Space tool.
Hey, thanks, Matthias. Just let me share my screen. Do you see my screen?
At the moment, we don't see the screen. We can see now prominently Matthias, whom I would like to thank for this fantastic presentation. And actually, I already have some points that I would like to ask you. But first, we will hear a short presentation from Pierre. If I can ask Pierre to keep it to the 10 minutes so that we allocate 15 minutes for the discussion in the end. Now we can see the first slide, Pierre.
Okay. Can you hear me well?
You can speak close to the microphone, that would be helpful.
Okay, I will go very quickly. And we have created a software a few years ago. As Matthias was mentioning, in 2012, 2013, we have started a heavy work already of the effects of green space on health. And during that work, it came out that there was also the possibility and the need to develop some software to support countries, to support cities. So I'm going to run this software in just in a minute. So I will probably skip the importance of the impact.
Yeah, if you can speak a bit closer to the microphone, it would be good because the volume is very low of your.
Can you hear me better now?
It's more or less the same.
Okay, I don't know. We tested the microphone before and was okay.
Okay, then we keep it as it is, not to lose time. Okay, go ahead.
Sorry. But quickly I will move to the software that we are testing. We have developed quite recently. The first thing that we have done in order to thinking, okay, what is really needed outside, it was a review of tools that are available for quantifying the impact of green space on Earth. And the other thing that we have been doing is a systematic review of the literature that is associating effects of green space on Earth. And we are also part of work that is going or that is being carried out for systematic reviews, for example, on the meta-analysis of the health effects of green space on mortality. The expert meetings has given us the direction to have a tool, and I will show you now very quickly the software. But one of the main discussions that we have had has been related to the conceptualization of the health impact of green space on Earth. Matthias has already shown you a slide, I think it's the 6th slide, where there is a kind of framework that puts together the natural environment, green space, and then health, the different pathways, the different impacts that we can expect from green space. The conceptual models that are quite abundant, and there are several available in different scientific literature. There are several scholars that are working on this, and we have been in contact with most of them. I will start now QGIS. QGIS is a freely available software. It's a professional software for geographical information system. So it's similar to commercial software that are available on the in the market. This is the first screen of QGIS, and now I'm clicking on the green space, GreenS Plus we call it. This is the tool that we have developed. This is the main screen. So this is the welcome screen. I think the quite interesting thing that I can show you is in the getting started. We have a conceptual scheme that we have been following to develop the tool. So the idea is that we have 3 different pathways, 3 different mechanisms that are relating green space to health. One is through mental health. In mental health research, we have the most evidence that is accumulating in the last year. So all the experts, the people that are working in health impact of green space, agree that mental health is the strongest effect that we have from green spaces. The other thing is that we have, as mentioned by Matthias, we have an opportunity for active transport, leisure activity. So that's another pathway that links green space to health. And then we have a third factor that is quite important, is the ecosystem services that are provided by green spaces. And these are related to the reduction of air pollution, for example, or the effects on cooling heat islands for the temperature. I go straight to the use of the software. This is a very simple software that I very complicated and sophisticated kind of analysis. I'm loading now the last project that I have that is related to the city of Barcelona. And for the city of Barcelona, we have to upload basically the green space of the city. So we need to have the boundary of the city, the green space that are in the city, and the population. So we are in a kind of classical exposure analysis. You need a factor, and there is a risk factor, and then you need a population that is exposed to this factor. I am showing you now the core of the business, that is where you define the green space. This is an important aspect, because when working with authorities, with city authorities in regions, this is one of the main discussions that you have. In some places, sports facilities are considered green spaces. In other places, cemeteries are green spaces, and so on and so forth. So I don't enter in the details. But the definition of green space from a data input is related to what kind of data you have available. And usually you have three kinds of data. You have satellite data, you have the data that are available on the internet, like OpenStreetMap, and then you have Urban Atlas that was produced from the European Union, that is that gives you data for Europe. And I go on with the software very quickly. I'm going to just to check what we can do with general impact. So we are not going with mediated mechanisms. I just show you that is what I presented before: ecosystem, active transport, and mental health. But we go for something that is simpler. First of all, we need to calculate how much green space we have in the city of Barcelona. The software is calculating quickly the fact that we have a very small percentage, like 5%, in the total area of the city of Barcelona. And what we are interested now is, can we see how many people are exposed, are within a buffer, a circle of 300 meters, and they have available at least half hectare of green space. And let's see what happens for Barcelona. This is the usual first step when you work in a city, when you work in an urban setting. So we have 1,350,000 people, and the people that are exposed, that are close to green space, and we have chosen an indicator that we have discussed in several lectures, like 300 meters, and at least you have half hectare available. The population is 35%. The software is sequential. You can see that I have to go back or forward. I don't move around as other software, but this is because the complications and the complexity of the software. We wanted to have something simple, even for people that do not know what a GIS is. Here I have another screenshot, and I'm just about to finish, where you can create simulation, where you can grow or shrink the green space that you have available. And then let's leave it as is. The only thing I want to do now is understanding what if in a population that has 1,000 per 100,000 rate for cardiovascular disease, we have some relative risk available, and we see what happens if for the cardiovascular mortality related to this exposure to green space. Quickly, I'll give you just an idea. And you see that there are 9 people. I was running very quickly, so don't look at the numbers. These are even likely numbers. We have 9 people that are kind of premature deaths that are avoided because of the presence of this green space in Barcelona. I think I can stop here. The idea of what we are doing, I guess, is quite clear. And I have a PowerPoint with all the slides and more slides where there is an explanation of the work that we are doing for anyone.
Thank you very much, Pierre. This is also very interesting, and actually it will be very interesting also to see all the slides, and we will share all the slides with all the participants of this webinar, so don't worry if you missed something. And it seems to me that the logic is similar to the other tools, and especially to the heat tool, which we had a webinar on a couple of months ago, where you can also have you get an estimation also of the avoided number of deaths in that case by increasing by a certain amount of time the activity on walking and cycling in a population. So thank you very much also for that. Now I would like to ask everyone to have questions through the chat. So if you have a question for Matthias or for Pierre, you can write this question in the chat, and then we will ask them to reply. So please don't be shy and ask whatever you think is relevant for the policy brief and also for this software which was already presented. Just a couple of points from the presentation that Matthias gave. It was very interesting to understand that sometimes the focus is very much on the infrastructure of urban green spaces and blue spaces, but then there's not so much done on the promotion of that specific piece of land. Then the two things needs to be done together. That was quite clear in the presentation, and I think that maybe this is also an aspect which is often overlooked. And it was a bit worrying for me to see once again that sometimes there are very many interventions with the best intentions possible, but evaluation is a weak point in many interventions, and without proper evaluation, then it is really difficult to establish the impact that we have of such intervention. And I'm saying that because, as I've also mentioned a couple of times during this webinar series, one of the focuses of our general program of work of WHO for the next 5 years will be exactly to have more impact on country level. But how can we measure impact if we don't know the evaluation of that specific intervention? So that's something to work more on. And also, I'm very pleased to see that there is a more focus now on the how to do things in relation to green spaces, because what to do maybe is rather clear, but there needs to be more focus on the how. And also this resonates very well with the Regions for Health Network, which is a network which is really focused on the practical know-how. So we are very grateful for that. Do we have questions? I don't see questions from the audience, but I invite you to really be active and don't miss the chance to ask questions to Matthias and Pierre. Please, you can enter your question in the chat, or if you want, you can also ask for the floor by raising the small hand that you have in the WebEx. And in the meantime, I would like to ask maybe Matthias if you could expand a little bit more about the equity aspects of green spaces, because this is an important, very important dimension. And next year there will be a major report will be launched in WHO Europe, the Equity Status Report, first of its kind. So that will present an equity status in all countries of WHO Europe. But when we go into the details of the landscape of green spaces, can you tell us something more about this aspect?
Yeah, thank you, Francesco. We started off in this work with a focus on the equity, because also within the European Centre for Environment and Health, equity is a major issue. We're also working on environmental health inequality reports that will also come out next year, and it will have an indicator on access and availability of green spaces and how this differs for different population groups, especially by income, because there's a lot of research and quite some data material that shows that access to green spaces is not equally distributed. One of the lessons learned, I had already indicated in the presentation. When you look into academic literature, you find equity a lot looked into as an outcome, and it's a research-driven agenda, but we have found that in practice on local ground, the equity and the targeting is more done by spatial setting selection. You have a disadvantaged neighborhood, and this is where you invest on urban green spaces, hoping that you uplift the area, you have better living conditions, different type of need. People might move or stay in the area, the housing market might stabilize, and so on. So this is a tool that is used to upgrade certain neighborhoods that need that. On the other hand, it also has a potential negative implication on the gentrification side. We have seen that in a lot of cities, the moment you, in general, you invest in an urban area, it will have a potential risk for gentrification, poor people moving out because the rent levels get higher, different type of people finding the neighborhood attractive and moving in, and it has some social implications that people that might have been living there for decades can't afford living there. So the intervention can have an equity objective to upgrade an area, but this could also have equity implications that are unintended. What we have learned from the case studies is that, for example, in Berlin, in a local park area, they have actually worked together with local housing companies saying that, look, the city will invest in this area, but then we want you housing agencies to not run away with a profit and throw out people because you have other renters willing to pay higher prices instead. We want you to work with us and have at least 10-year stable contracts, rising the rent levels only moderately, so that the intervention we do really will benefit the people living there right now and not make them move out for financial reasons. So there are different ways to tackle that. Another example was from a city saying that they try to distribute the green space interventions so that you don't invest a lot of money in one neighborhood, and there you might have a lot of social selection and gentrification issues, but they rather tended to say, like, we do a smaller park here, we upgrade the playground there, we do something on the sports or school area there, and it's accessible. So they were trying to distribute more smaller green space intervention across the city to make sure that there is not one gentrification effect in one area because all the money goes into this, and then you have these social selection issues. So there were different ways for local authorities to deal with it, but I think it does remain quite a strong problem in many places. A last point I would like to make on the equity is that we have this function and conflict issue, and it also has something to do with equity, because everybody should have access to green spaces and be able to do their interests, be it hobbies or walking, sports, leisure. They should be able to do that, and often we have green spaces that allow for one or two functions, but not for others. Often green spaces are too small to facilitate all kinds of functions, and that's also a major challenge to make sure that if you want to have green spaces that enable a wide range of functions, they have to be large. If you have smaller green spaces, they cannot allow for all green space functions, and then you need more of the smaller ones to balance the different types of needs to make sure that every population group and every type of use is possible.
Matthias, this is really so much interesting. There will be so much to say that maybe we should set up maybe another webinar just on the equity aspects of that, because this is so relevant, and I think that there are many cities that are really planning things without thinking of what you have just said, and this is absolutely right, that sometimes you invest a lot in one part of the city, the market price increases, and then you obtain the opposite intended effect. I think that we have a question from Camilla.
Well, thank you very much for two very interesting presentations and the impressive work that you are doing. Nature is important, and I actually just read that in Scotland now, doctors can prescribe nature for mental health issues. So it's going to be a pill in a way. But I have a question to Pierre about the tool. And I was wondering, do you have actually done data on greenness, urban greenness for all European cities? And I also wonder, is this data on accessible green areas, or is it just like green cover?
And if I can add, we also have a question from Athens about that for Pierre. What kind of data indicate behavior changes, and also in which city is already used a green S plus?
Okay, I go for availability of there's a lot of data on for Europe on the availability of greenness for inhabitants. So the European Commission has already published reports, and there are papers that have been measuring the availability of green space in most of the European cities, the big capitals and the main cities. So it's not a big issue to have that kind of data. That data comes usually from the Urban Atlas, so the elaborations that are related to the work that has been going on for many years with the European Environmental Agency. So there's no problem in having that data. With our software, we can recalculate the availability of green space. And I go then to a little bit more technical detail, the fact that you have different sources for green spaces. One is given by satellite, so you have the image, you have a raster, you have some pixels that are, and you have an index that is of the vegetation that is given to you, but this changes usually through the seasons. And the other thing is that you can have other sources of data, for example, OpenStreetMap that we strongly suggest. So you work with land use data in that case. And with land use, you enter in, I think, in a different world also for public health practitioners, for people that work in public health, because they are able to enter in discussions and engage planners, decision makers, and stakeholders. So I hope this answers to your question. The second question about behavioral change. I think that's a tricky situation because we have the less evidence that we have on the green spaces effect on health is related to changes in behavior, for example, for physical activity. We are working on that, and we still haven't found, I think, a solution to make an estimation that gives you an idea about the changes that are related to the presence or absence of green spaces. We're working on this. I'll show you very quickly the conceptual note that we are following after expert meetings, and that is a part that we are taking into account. Our dream, as was mentioned by Francesco, just is to have something that will produce an output like more likelihood or more distance that is covered by people because of an intervention on green space. And this output can be used in our software that calculates exactly the impact for working and cycling of changes in behavior. The third point on the cities, we have been testing this software in the last 3 years in Barcelona and Maastricht. Barcelona because we have the IC Global working with us, and Maastricht because the University of Maastricht has been responsible so far of the cooling and heating island effect. That is the most sophisticated model that we have. I haven't shown you because it takes 15 minutes to enter in all the details of the calculation. And but I am directly applying with all other WHO colleagues in S Plus in Asia, in Kathmandu, and in Africa, in Accra. And we want to see if we can go a little bit outside our Euro or North American kind of availability of data and work also with lack of data and difficult situations.
Thank you very much, Pierre. One last chance for you to ask anything to our two speakers. And in the meantime, I would like to ask maybe a last question before you have any, if you have
Francesco?
any. Yes, Matthias?
I mean, there have been 2 questions sent, I understand, privately, so not to the whole group, that I can read and go through, because I think only we can see them.
Yes, please, if you can read the question, and so that also the others can understand.
Yeah, there was one question on how to best reach the population for green and blue spaces, and if there is a WHO tool developed for it, like, for example, the Scottish Place Standard tool. So first, thanks for the question. There is no specific tool that evaluates place or has that specific focus. We do have some of these topics in the action brief and make some recommendations. I think in a nutshell, the main thing is planning. If urban planning is done in a way that the use of green spaces is natural, the easy choice to get from A to B, that taking the bike, walking through the park, having facilities in there that makes you use them, that would be the best way, because it automatically makes people use them for daily life and not, oh, I want to go jogging in the park, it's an active choice, and then you go, and some people choose not to go because you don't need it. So adding it as a part of daily life would be the most effective thing, but it's not that easy. What we learned from the case studies was the use to use local champions, be it a local sports celebrity or somebody who opens a park or has an event there, using it for cultural events from local clubs and city celebrations, drag people into the park and in green spaces that otherwise might not use them, and they might find that nice and go there again. Social prescribing was mentioned before. There is a way that doctors actually say, well, look, I don't give you medical pills. I say you go twice walking in the park. That's another way to maybe reach out to people that are not that prone to go into the park. And another thing that was highlighted by many in one of the case studies is to approach it through children, because parents might go to the park with their children for play or walk the dog. So they do it for someone else and not for themselves. And this could be used to get to people because they want to achieve something for somebody else, but they go along with their child or with their dog. And this could be also promoted. The second question was, Philip, scroll down, thank you. Are there models for architects and planners regarding how to integrate green spaces in the general shape of the city? And there seems to be an Italian example on the green mesh. There could be a model. I think there's in different cycles of planning, you will find from the 60s, the 70s, the 80s, and the 90s, different ways of urban planning, and you will find green spaces embedded more or less in some of them at a different idea, whether it's a compact city or a green spaces. So I think it's difficult to say what is the one to use. I think one of the general trends right now is the term green infrastructure, which has the idea that you connect green spaces to the extent possible, and that you have really the opportunity that people, especially for mobility, go through green corridors and green lines. So you don't only have a park here and another beach area there, and that's it. And you might have a lot of square meters of green space, but only at 2 locations, and they are not connected. But with the green infrastructure approach, that you try to make this link, that it's really a network which enables especially mobility along the green corridors. I think that's one of the approaches used currently, but there will be many more, and it's difficult to say which one should be the best.
Thank you, Matthias. This is also very useful and interesting. 2 small things, small questions, if I can ask. One is about, because we all live in multi-cultural societies, and if you can say something about cultural differences in using green spaces and how to address that also. Because I guess that this is becoming more and more relevant. And also I know that you are participating in a very important global forum which is going to happen shortly in Italy, in Mantova, I think. It's the Urban Forestry Forum. If you can also mention something about that. I think that there is a huge momentum now for green spaces. I can hear green spaces all over the places. So I guess that this is maybe a good momentum to work more on that. And also, if you can name reasons why there is such an interest now for green spaces in this very specific moment in time. Is it due to the 2030 agenda, which maybe created some momentum, or is there something else? And how to best use such a moment? Because we have it now, we might not have it in 10 years. Thank you.
Okay, thank you. Just in short, to start with the first question on cultural diversity, we have looked into this separate from the Green Space project with some review on how different cultures use green space differently. And I think to have one example, because it's much too diverse, it seems that like in taking Germany or maybe Belgium, UK as an example, the idea of green spaces is that you walk out into a forest and you really expose yourself to nature and you have this recreation and restoration effect. Well, it seems that, for example, population groups coming as in part of the migration, it has often been made as a statement that green spaces will help foreign people to integrate, and it shows that the way they use green spaces might be different because they're used to different type of green spaces in their home countries and in their cultures, and also there's a different use. So for example, you would have more a family gathering and a barbecue in the park, so it's an outside activity, but it's fundamentally different and much more a social dimension than walking out into the forest for half a day and really leaving the city and the daily stress behind. It's a more social use, while maybe in our countries, in Spain, UK, Sweden, it's really more going out into nature rather than using it for social events. That's one of the examples of differences, and it's very interesting to go further on that one. The second thing on the events, there will be the first World Forum on Urban Forests taking place in Italy, in Mantova, at the end of November, and we will be contributing also with some background on the urban green spaces, and we're happy that the Italian translation of the action brief is ready, so I can promote it there as well. And before, just the days before, there will be an urban transitions conference in Barcelona, where we will present on the blue spaces. So as you say, it's a very good time for both blue and green spaces. And I think it is due because there's an increasing interest in lifestyle and life cycle. And also I see that the setting approach is getting stronger again, because we increasingly acknowledge that an individual makes choices, but in a certain context. And the setting has a huge influence. The setting allows or restricts a lot of functions. So if somebody doesn't want to go jogging in a park, there's nothing we can do, and we try by promotion to get this person interested in running in the park. But if you don't have a park, then you have a totally different problem. So I think this setting approach is something that comes increasingly into focus, and I think this is why green and blue spaces are high on the agenda, and just showing how much health and well-being benefits you can have by green spaces, I think makes a strong case that this is one of the most important settings that we can work on in urban places.
Thank you very much. And with that, I think that we need to close because we are already a bit late in terms of our usual format of 60 minutes, but the topic is so interesting that we could go ahead for hours, I'm sure. In any case, please, if you have specific questions to Matthias or Pierpaolo, just let us know, and we will make sure that we direct the questions to them. And I think that the main aim of this webinars is to let you know that there are tools, policy briefs available on specific topics. And then, of course, if you have specific questions, we are here to support you. Once again, thanks to our great speakers, Matthias Braubach and Pierpaolo Mudu from the Environment Center, European Center for Environment and Health in Bonn. And thanks to everyone who helped with the IT connections, and to all of you who made the time available. The next webinar is the last of this series of webinars, and it will be on health impact assessment, another very important topic. And it will be on Thursday, the 6th December, so in about a month. I guess that I will see many of you at the European Public Health Conference in Ljubljana on the from the 28th to November to the 1st of December, where we also have another workshop done in collaboration with the European Center for Environment and Health, which will be on air pollution and active mobility. So this will take place on Friday that week in the late afternoon. You are all warmly welcomed to this workshop there. And thank you again for your time, and see you next month for the last webinar. Thank you very much. Bye-bye.
Thank you and goodbye.
Thank you.